Good morning, good afternoon, and good evening, honorable ministers, excellencies, and distinguished delegates. The Assembly is called to order. Before we start, may I ask all those delegations having raised their hands prior to the meeting to lower them now. And many thanks for your cooperation. Before we start formally, on behalf of the Secretariat, I would like to apologize for some of the technical issues we experienced yesterday. We're working them out, and we just need your patience and understanding. This is a new process for us all. Now, let me begin with a brief word about rights of reply. If a right of reply is requested during today's meeting, I would propose to give the floor to the delegation concerned when we open item 9, closure of the Assembly, rather than wait until the very end of the meeting in order to avoid disrupting the suspension of the Assembly. I trust that this would be acceptable to all concerned. We will now turn to item 6 on the election of the Executive Board. Regarding item 6, Circular Letter 15.2020, which addressed this item, was distributed yesterday to all delegations. As noted therein, an objection was received from a member state in connection with the list of candidates. Fortunately, I can report to you that following informal consultations among member states, it is my understanding that the delegation of the member state concerned will not block consensus on the list of candidates we are about to consider. In this connection, please allow me to express appreciation for the goodwill of all concerned in respect of this matter. Accordingly, I draw your attention to the list of 10 members, which has been formally circulated to all member states prior to this meeting. If elected, these 10 members would provide a balanced distribution of the board as a whole. These members are in the English alphabetical order: Botswana, Colombia, Ghana, Guinea-Bissau, India, Madagascar, Oman, Republic of Korea, Russian Federation, United Kingdom of Great Britain, and Northern Ireland. May I therefore take it that there is no objection to the Assembly proceeding in accordance with the rules of procedure and the special procedures to elect these 10 members as proposed. Okay, I see no objection. I see no objection. I therefore declare the 10 members elected. The election of the 10 members will be duly recorded in the records of the Health Assembly. Before we proceed further, I understand that the delegation of Ukraine wishes to take the floor on this matter. I therefore give the floor to the Honorable Delegate of Ukraine. You have the floor.
Madam President, Director General, Excellencies, colleagues, Ukraine has already informed the WHO Secretariat on its position regarding the candidature of the Russian Federation to the EB. At the same time, recognizing the importance of the uninterrupted functioning of the WHO under these unique circumstances caused by the COVID-19, Ukraine has decided not to block consensus. Nevertheless, Ukraine dissociates itself from the consensus on the candidature of the Russian Federation. The reasons are obvious. The Russian Federation has been constantly violating norms and principles of international law with regard to sovereignty and territorial integrity of Ukraine, including the demands of WHA resolutions, territorial integrity of Ukraine, situation of human rights in the Autonomous Republic of Crimea and the city of Sevastopol, Ukraine, as well as problem of the militarization of the Autonomous Republic of Crimea and the city of Sevastopol, Ukraine, as well as parts of the Black Sea and the Sea of Azov. The Russian aggression against Ukraine has led to a significant degradation of the healthcare system in the temporarily occupied territories of Ukraine. The Russian occupation administrations in Crimea and Donbass conceal the data about the situation with the coronavirus spread and manipulate their statistic on identified COVID-19 cases. Russia's violations of international law and its obligations as the occupying power make it impossible for Ukraine to provide medical assistance directly to the population of the temporarily occupied areas. Aid from international community has also been significantly impeded due to continued violations of the ceasefire regime by the Russian occupying forces, as well as the closure of access by the occupation administrations for the UN agencies and other international humanitarian organizations. Russia deliberately ignores complaints about the poor health conditions of the Ukrainian hostages illegally detained by it, even when their symptoms are similar to COVID-19. I hope that these points will be duly taken into account while considering the situations that require WHO's special attention. The full text of the statement will be posted at the WHA website. I thank you.
I thank the delegation of Ukraine. The efforts to remain brief are appreciated. I understand that there are no requests for the floor at this time. Thank you for the cooperation and understanding of all. We will now return to item 3 to hear the the statements by delegations which are provided under this item. And before I hand the floor over to the Secretariat, I would like to apologize to delegations yesterday who we may have had to interrupt statements given the length of the statement. Yesterday was a long day for all. The length of time for allotted statements were previously agreed by member states, and we sought the cooperation of all delegations in abiding by the length of time agreed. I recognize that some interventions were made by honorable ministers. I also recognize that the session is an important one for member states to address concerns that are particularly sensitive given the topic under discussion. However, I would like to urge honorable delegates who may be making statements during the course of discussion on this item to please observe the time limits previously agreed. I will now
give the floor to me to explain when the rights of reply will be explained before we open.
Thank you. I understand before we proceed with our discussion on item 3 that legal counsel from the Secretariat would like the floor. I will turn the floor over to the legal counsel from the Secretariat. Sir, you have the floor.
Thank you. I think there was there have been a couple of questions about exactly when rights of reply will be afforded to member states following the statement that you made at the beginning, Madam President, and I've been asked to clarify when that would be. In accordance with the rules of the meeting, rights of reply will normally be given at the end of the meeting. We indicated that that would be during item 9. Item 9 will be opened, and then we'll move to item 4, which is the invited guests, and then item 9 will be resumed. My understanding, it will be during the resumed aspect of item 9 that any rights of reply would be issued. Thank you.
Thank you for that clarification. So, honorable delegates, we will now resume our discussion of item 3, and I will turn over the floor to the Secretariat. Sir, you have the floor.
Thank you, Madam President. We do have a few countries outstanding to make their statements, and a number of UN agencies as well as an observer. That said, I would invite El Salvador to make their statement. El Salvador, you have the floor, please.
Señor Director General de la Organización Mundial de la Salud, señores ministros.
Director General of the WHO, ministers and health ministry representatives, and representatives of regional health organizations, ladies and gentlemen, El Salvador saw the viral storm clouds that were gathering on the horizon around mid-January. At this time, the disease has really given us a dose of humility and solidarity, because no country can emerge from this emergency without cooperation from everyone. This is why I would like to express our appreciation for the cooperation from many countries and the WHO and PAHO. Our President Nayib Bukele charged us with a single mission to save lives, and that is what we've done, but with great difficulty, and we are moving forward thanks to an integrated vision of our work. I would like to take advantage of this opportunity to refer to specific aspects that are not on any graph, but are part of this fight and are fundamental. This crisis has shown the potential of our work as healthcare workers, since we are on the first line saving people, doctors, nurses, and the support from other stakeholders such as police, army, transport workers, and the business sector and the population has made it possible for us to move forward. And once the pandemic is over, we should not forget this example of solidarity. Thank you.
Thank you, Honorable Minister. We will now invite the Minister from the Emirates. You have the floor, sir. Sorry, my mistake. Timor-Leste. Timor-Leste, you have the floor, please.
Honorable Chair, His Excellency, Director General of the World Health Organization, Excellencies, distinguished delegates, ladies and gentlemen, I would like to start by first congratulating the elected President and Vice President of the 73rd session of the World Health Assembly. The inspiring deliberation of Director General Dr. Tedros is a reminder of the global health challenges that need to be addressed, especially during the COVID-19 pandemic. As of today, 18 May 2020, we have had 24 confirmed cases of COVID-19. Apart from a few sporadic cases, all others are linked to well-defined clusters within government quarantine facilities. There is currently no evidence of community transmission. We are now approaching the end of the second month of declaration of the state of emergency, which has included travel restriction, managed migration, and other social interventions. Following our first confirmed case on 21st March, Timor-Leste has rapidly transformed from a country with no testing capacity, no identified isolation and quarantine facilities, and a limited surveillance capacity to one with in-country testing. Functional COVID-19 facilities, staff rapidly trained for surveillance and COVID-19 management, a gradual increase in stocks of PPE, capacity for an expanded testing and surveillance strategy over a relatively short period of 5 to 6 weeks. I would like to express my deep gratitude for the support we have received from the World Health Organization in strengthening our COVID-19 response. The technical and logistical support from the country office and the regional office, including the supply of our first batch of PPE and test kits, have been crucial for a rapid and comprehensive response. The Ministry of Health appreciates the continued support from Dr. Rajesh, WHO Representative, Timor-Leste, and Dr. Poonam Katrapal Singh, Regional Director, WHO Southeast Asia Region. COVID-19 has emphasized the criticality of a strong and resilient health system focused on primary health care as the best response to this and future pandemic. Timor-Leste is firmly committed to providing universal health care to all its people. We pledge to work in solidarity with the international community and are encouraged by the intense collaboration to develop effective vaccines, medicines, and technologies. We appeal to other member states to treat this as a public good and ensure their equitable distribution, as this pandemic is starkly reminding us no country is safe until every country is safe. I thank you.
I thank you, Honorable Minister. We understand Pakistan is not yet ready, so we'll proceed to call on the Emirates, followed by Nicaragua. Honorable Minister from the Emirates, you have the floor, please. We do not seem to have the Emirates online either. We would proceed to Nicaragua, followed by Egypt. Nicaragua, you have the floor, please.
Madam President, we demand that vote not be used by any power or organization to exercise political and economic pressure on our country or on any other country. It is unacceptable that while we speak of the unity of the countries in the fight against the pandemic, countries that fight to maintain their sovereignty and self-determination, as is the case of Nicaragua. Madam President, we advocate the inclusion of Taiwan as a member state of the World Health Assembly. In light of the demand for critical supplies required to confront COVID-19, we ask you to review the principles for equitable access for the countries of the Americas. By adopting the 2030 Agenda of the United Nations, we are committed to advance towards a more equitable and just society, to close the gap within and between nations, especially to be inclusive and universal, not leaving anyone behind, even in times of COVID-19 pandemic. Thank you very much, Madam President.
Thank you very much, Honorable Minister. We would now invite Bosnia-Herzegovina. We understand Egypt and Senegal are not yet ready, so Bosnia, you have the floor. We are unable to connect with Bosnia. We would now move to Palau. You have the floor, to be followed by George, St. Kitts and Nevis. Palau, you have the floor.
Excellencies, honored guests and members of the Assembly, ladies and gentlemen, let me begin by expressing our heartfelt appreciation to Dr. Tedros and the World Health Organization and its staff for the important work they have and continue to do to protect our health and the health of all the peoples of the world. I cannot even begin to imagine the burden that the WHO carries each day, especially during this global pandemic. Earlier this year, when the WHO declared a public health emergency of international concern for this COVID-19, my country felt a grave apprehension as we were not at all prepared to face the devastation of this virus. We did not have the capacity or the infrastructure to respond in the likelihood of the COVID-19 reaching our borders. Similarly to the WHO's call for solidarity amongst all nations, the Republic of Palau and its people value genuine friendships and critical bonds forged out of mutual respect and adoration for life, peace, and unity. Taiwan was the first country to lend Palau a helping hand, followed by many other countries who are present at this assembly. Taiwan and many of our allies knew that our country was vulnerable, so they made tremendous sacrifices to give Palau all the equipment, supplies, and training that it needed in its efforts to prepare and to protect its people. I'm happy to report that my country now has sufficient testing capabilities for COVID-19 and all the necessary supplies and infrastructure to manage the spread of the virus in the event of our first infection. All this was made possible through the simple act of kindness and solidarity from Taiwan and many other member states in this meeting today. Taiwan has not been invited as an observer in the WHA for a while now, but they believe in the WHO's call for solidarity, as do all of us. Despite them being denied participation, they have and continue to help protect the health of many around them. In closing, to all fellow member states, our vision and the mission of the WHO is health for all. Solidarity can only be achieved if and when every single human soul are united. I ask you to consider allowing Taiwan to finally join us as an observer, that we may work together to realize the vision we have all fought for since the formation of WHO. Thank you.
Thank you very much, Honorable Minister. I understand we have St. Kitts and Nevis. You have the floor, to be followed by Senegal.
Mr. President, Director General, Excellencies, Heads of State and Government, Honorable Ministers of Health, Heads and members of delegations, I am pleased to address this body to share St. Kitts and Nevis's situation and response to the COVID-19 pandemic. On March 25, 2020, we recorded our first case. Currently, there are 15 confirmed cases with no community transmission. 14 persons have recovered. There are no hospitalizations or deaths. This is a remarkable achievement for a small state in the Western Hemisphere. Our achievement can be attributed to its rigorous public health response and an all-sectors approach with requisite legislation and regulations to guide our response. Early closure of our borders, scrupulous social distancing, meticulous respiratory and hand hygiene practices, and heightened public education awareness programs were key strategies used to contain the spread. Our national response included recapitalization of our health facilities in terms of equipment, physical infrastructure improvements, human resource capacity building through a medical arrangement with Cuba, and training of all frontline personnel in health, business, and national security. Our healthcare system also benefited immensely from the support of the international health agencies such as Pan American Health Organization, PAHO, and the Caribbean Health Agency, CARPHA. Our success in addressing COVID-19 is due in part to our relationship with Taiwan, who has donated considerable sums of PPE in addition to providing early expert review of our national pandemic response plans. Taiwan's own success story stands out for commendation. Just 440 confirmed cases with a minimal community spread in a population of 23 million people. There's much to be learned from Taiwan's handling of the pandemic. As has been done consistently over the years, our country again makes an appeal for Taiwan to be granted full membership status in the WHA. Taiwan has made significant contributions to the world: knowledge and technology transfer, mastery of universal health coverage, and disaster response and mitigation. Mr. President, global success in winning the war against COVID-19 will be largely dependent on strong leadership at all levels: government, the private sector, and civil society. The focus must be on saving lives, safe vaccine development, and recalibration towards a new normal that includes the right to health and life and the dignity for all people. I thank you.
I thank you, Honorable Minister. We would invite Senegal to be followed by Zambia. Senegal, you have the floor. Very well, we don't seem to have Senegal online. We would move to Zambia, followed by Georgia. Zambia, you have the floor. Zambia. We would move on to Georgia, followed by Vanuatu. Georgia, you have the floor, please. We understand Georgia is not available. Could we now move to Vanuatu, followed by Uganda? Do we have Georgia online? Okay, we will go with Vanuatu. We don't seem to have Vanuatu. We will go with Uganda. Honorable Minister, you have the floor. There is no response from the Honorable Minister from Uganda. Could we proceed with Iraq and then Comoros?
أصحاب السعادة المحترمون السيد مدير عام منظمة الصحة العالمية المحترم بالرغم من
Mr. Director General, in spite of the challenges facing Iraq in terms of security, resources and the shortages in health care workers, we were able to confront COVID-19 and were able to involve all sectors. Iraq, since the beginning of the first signs of the crisis, has taken preemptive measures to record all cases. Public gatherings were prohibited, restaurants, cafes and bars were closed, which has enabled us to conserve the capabilities we have within the health sector. Since the beginning of the crisis, we were able to record more than 3,500 cases, and we were able to keep death cases at bay. However, the consequences and the impact have varied on the economic and social sectors. We continue to work under the umbrella of the United Nations and the World Health Organization to make sure that we benefit from the technologies available.
Comoros to be followed by Kiribati. Comoros, you have the floor. We understand Comoros is unable to make a statement. Could we now invite Kiribati, followed by Malawi? Kiribati, you have the floor, please. We don't seem to have Kiribati online. Could we invite Malawi? You have the floor. Unfortunately, we don't have Malawi. Could I now invite Solomon Islands to be followed by Sudan? You have the floor, Solomon Islands. We will proceed to Sudan, followed by the Democratic Republic of Congo. Sudan, you have the floor, please. Very well. We would go with Democratic Republic of Congo to be followed by Pakistan. DRC, you have the floor, please. We don't have Democratic Republic of Congo. Could we now invite again Pakistan to to be followed by the Emirates. Pakistan, you have the floor, please.
Coordinated, collective, and sustained action among countries and institutions to suppress and mitigate this pandemic. It is clear that no country alone can protect itself from this contagion. Solidarity and unity is therefore vital to tackle morbidity and mortality, to ease burden on the health systems and support national and global economies. Pakistan endorses the statement delivered by the Chinese delegation on the issue of Taiwan. Pakistan fully supports China's efforts to safeguard its sovereignty and territorial integrity. In line with iterations of general committee, year after year, Pakistan's position is that there is only one China and Taiwan is being an integral part of China. This session of the World Health Assembly is significant in many ways. As the premier global health parliament, it must lend its full support to the ongoing preparedness and response plans and strategies. The Assembly must support growing calls for development and production of COVID-19 related diagnostics, therapeutics, and vaccines that are affordable, equitable, and accessible to all. Our Prime Minister Imran Khan has already given this call for the people's vaccine. Pakistan has reported significantly lower numbers than the initial international projections, especially considering that Pakistan is the fifth largest populous developing country of the world. Despite these numbers, we are not complacent and are taking every possible step to combat this pandemic. We have started trace, test, and quarantine strategy, and we have also launched a We Care campaign for the protection and the support of our frontline health workers. Some of the lessons learned from the outbreak of this pandemic include the need for enhanced investments in national and global pandemic preparedness, detection, and response mechanisms, of core capacities under IHR, and improved pandemic response financing mechanisms. WHO and member states must take the opportunity to start imagining the future of healthcare in post-COVID-19 world. Current political global attention must translate into strengthened essential public health functions in all the countries. And more than ever before, world needs primary healthcare-based universal health coverage. The world is bearing the fallout of this pandemic in so many different ways, including the spread of other diseases, as those have remained relatively unattended over the last 3 months. And at the end, I want to emphasize the need for taking a human rights approach and a collective action for voiceless poor suffering through these tough times. I thank you very much, Mr. President, and I commend the WHO leadership in these tough times. Thank you very much.
Thank you, Honorable Minister. We will now invite the Minister from the UAE. You have the floor.
نيابة عن معالي وزير الصحة ووقاية.
On behalf of His Excellency the Minister, I take the opportunity to express my gratitude and thanks to the President of the 73rd WHA, and I would like to congratulate her on her election. I would like to thank Dr. Tedros and all members of the organization for their efforts in helping in confronting COVID-19. Your Excellencies, ladies and gentlemen, we're meeting at a time when COVID-19 is casting a gloomy shadow and makes it imperative on us to take unprecedented measures. In this regard, the United Arab Emirates has set up a comprehensive emergency system at all levels led by the government to respond to this crisis. The Ministry of Health has started more than 1.5 million PCR tests, and this represents one of the highest levels in the entire world. And we continue to conduct 50,000 tests on a daily level. And the most recent report by WHO shows that the United Arab Emirates ranks 9th in the preparedness for dealing with pandemics. We take great pride in having the city of Dubai as a center for warehousing for the provision of medical requirements all over the world. We take great pride in our partnerships and our cooperation with the organization, where we provide a lot of support materially and in kind, and we provide aircraft to transport these contributions. We continue to contribute to international efforts to ensure world security as far as health is concerned. Thank you.
Thank you very much, Honorable Minister. We understand Georgia is back online. Georgia, you have the floor, please.
Sehr geehrte Frau Präsidentin.
Honorable President, Honorable Director General, distinguished delegates, I would like to take this opportunity and thank you all for enormous efforts and solidarity in the fight against COVID-19. Starting from January, Georgian government has been taking drastic measures to contain the spread of COVID-19 by employing adequate social distancing measures, mobilizing healthcare facilities, and establishing fever response programs at primary care level. The key factor determining our success was rapid response and prevention. In particular, targeted testing, isolation, and treatment of all possible cases. Technological solutions enabled us to continue teaching at schools and universities and promote online working platforms. We have launched a special application for contact tracing to protect health of every citizen. 20% of our country is occupied. Unfortunately, that is why the central government of Georgia does not have full information about the epidemic situation in the occupied Abkhazia and Skhin Valley regions. The central government of Georgia, with support of UN agency and other international partners, is ready to provide assistance to its citizens in the occupied territories. The joint and highly coordinated actions of the government and relevant institutions enabled us to contain the infection and keep the virus positive cases minimum. The pandemic showed to us once again how important it is to strengthen capacity of primary care services, advance regulatory framework for adequate infection control, and expand our programs for immunization and chronic disease management in order to minimize devastating outcomes of comorbidities. Guidance provided by the WHO through the whole national response has been extremely helpful. We appreciate the opportunity to join the Solidarity Trial and will do our best to contribute towards joint efforts for finding COVID-related solutions. I thank you.
Thank you very much, Honorable Minister. May we now invite the Democratic Republic of Congo to take the floor. Honorable Minister, you have the floor, please.
La République démocratique du Congo.
The Democratic Republic of the Congo is pleased to take the floor on the occasion of the 73rd World Health Assembly, which is being held in unusual circumstances marked by the COVID-19 pandemic. The DRC would like to acknowledge the remarkable work performed by the WHO in supporting multiple countries, including mine, in their fight against this horrible disease. My country had its first case on March 10th, 2020, and since then, more than 1,500 cases were confirmed in that province and later in the country. In our response, despite the efforts deployed by my government and our partners, there are major challenges which remain when it comes to diagnosis, care, and surveillance. Also, my country is facing other challenges related to health which require attention from all stakeholders, including Ebola in the eastern part of the country, as well as rubella and polio. There are other diseases which are plaguing our country, but COVID-19 reminded us of how important it is to strengthen and enhance our healthcare system so that it can be resilient and we would be able to move towards universal health coverage. Hence, are stressing the need for international solidarity in order to face the realities in our country. This is why the Democratic Republic of the Congo would like to invite the WHO to work towards specific measures in order to ensure better efforts in order to prepare for world health emergencies, particularly in countries that recurrently face health emergencies, in order to allow for the necessary task teams and forces to carry out the necessary interventions. Thank you very much.
The request for the floor from our member states. We understand that a video has been received from the Order of the Malta, but it's not ready yet. We will therefore move to our UN agencies and then come back to Malta when the video is ready, Madam President, if I may. So I'll proceed to call on the World Food Programme. You have the floor, followed by the IOM. World Food Programme, you have the floor, please. Okay, we will move to IOM.
Honorable Chair, Director General, delegates, in the face of COVID-19, the International Organization for Migration reiterates the need for inclusive approaches and calls on countries to combat stigma and address the specific vulnerabilities of migrants while recognizing them as key stakeholders themselves, whether as part of the health workforce fighting this pandemic or as contributors to future socio-economic recovery. As your committed partner on promoting the health of migrants, IOM continues to implement policy and operational measures on the human mobility dimensions of this pandemic, including migration communication campaigns, population mobility mapping, health capacity development at points of entry, and cross-border coordination, while ensuring continuity of care for essential services such as TB, malaria treatments, and routine immunization. Moving forward and respecting UHC principles and international solidarity, we must ensure that migrants, regardless of their legal status, have access to future therapeutics and vaccines, especially in low-resource settings. Thank you.
Thank you very much, IOM. We understand Order of Malta is ready. We will give you the floor, sir.
The Sovereign Order of Malta is contributing to the global response to the COVID-19 pandemic through its worldwide humanitarian action. It is of greatest importance to reaffirm here the necessity for the broadest possible international cooperation between all stakeholders. We wish to commend the WHO leadership in the fight against coronavirus. The vital role played by faith-based institutions in this emergency is being widely acknowledged. WHO recognizes that religious leaders, faith-based organizations and faith communities can play a major role in saving lives and reducing illness related to COVID-19. It published practical considerations and recommendations specifically for them. The Order of Malta has adapted its medico-social activities and centers accordingly. Its hospitals, clinics and ambulance services are fully active. It helped establish field hospitals and provide PPE, respirators and medication to state institutions and hospitals. Maltese International is intensifying hygiene kit distribution and wash programs, especially for displaced persons in camps. Furthermore, the Order's government recently launched the Doctors to Doctors project with the aim to gather on a virtual platform health experts sharing knowledge and strategies. The project is intended to help countries facing socio-political instability, economic challenges, violence and conflicts to deal with the pandemic. The Order has also scaled up its social services, distributing more food, water and medication to elderly, homeless, isolated, disabled and terminally ill persons. Psychological hotlines and online
Thank you, Madam. We will now move to the African Union Commission. You have the floor, to be followed by the Commonwealth Secretariat. Thank you. We would invite the Commonwealth to make their statement before the African Union. Commonwealth Secretariat, you have the floor, please.
COVID-19 threatens to set back progress towards our goals of achieving universal health coverage and the Sustainable Development Goals. The Commonwealth is mobilising to tackle this pandemic and its far-reaching economic and social ramifications. Our health ministers last week held their first ever virtual meeting to share best practice and reaffirmed their commitment to a coordinated approach to ensure that none are left behind. I commend to this Assembly the Commonwealth Ministerial Statement issued on behalf of our 54 members, representing 1/3 of humanity. In accordance with the values and principles of the Commonwealth Charter, it commits us to solidarity and mutual support in responding to COVID-19 and the ensuing economic challenges with continued attention to the needs of the most vulnerable in society and to tackling climate change. Our healthcare workers represent so much that is noble and best in humanity. Their shining example of professional dedication and selfless service should illuminate our thinking and the proceedings of this Assembly. This pandemic is affecting every aspect of our human existence, and to fight it, we need a whole-of-government approach. It brings home to us, as never before, the urgent need for multilateral action. I thank Dr. Tedros for his steadfast leadership of the global response through the WHO and pledge our Commonwealth support and continuing multilateral engagement to this fight.
Thank you, Madam. We will now invite the African Union Commission.
Assalamu alaikum wa rahmatullah. Of the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, and to extend his greetings to WHO and to the Director General of WHO, His Excellency Dr. Tedros Adhanom. Excellencies, the ongoing COVID-19 pandemic has reignited the need for global health solidarity and partnership in order to arrive at collective and decisive solutions that will advance global public health security and safety. They have endorsed our joint continental strategy on COVID-19 and also they have instructed the chairperson of the African Union Commission to establish the anti-COVID-19 response fund. Heads of states and governments, they decided to establish 3 coordinating committees, one for the ministers of health, another committee from the ministers of finance, a 3rd committee from the ministers of transportation. We must work hard to avoid our response to COVID-19 from halting progress towards ending the epidemics of HIV, TB, and malaria, as well as maternal, newborn, and child health, and reversing hard-won gains in mortality and infection rates. The Commission would also like to use the opportunity to express its appreciation to all health workers and allied personnel. We give condolences to those who lost, to the families of those who lost their lives on the front lines of combating and fighting COVID-19. Excellencies, thank you very much for listening.
Thank you very much, Excellency. Could I now invite South Center to take the floor, please?
Excelencias,
Excellencies, delegates, it is an honor to address you on behalf of the South Center, an intergovernmental organization of developing countries, which is an observer here. I would like to focus on 3 specific messages, bearing in mind the time limits. First of all, we should consider all medications, vaccines, diagnostics, and instruments necessary to face this crisis as global public assets, as was recognized by the United Nations last April 24th. Secondly, this is the occasion to rethink this organization, to make it a public, independent organization which would use all of its means of pursuant to its constitution. And also, we need to carry out research so that this research will not only be guided by commercial interest, and it would be focused only on access. Thank you very much.
Thank you very much, Excellency. Madam President, we've exhausted the list of speakers. We do, however, understand that a member state has asked to speak. We would want to give the floor to the member state, Madagascar, and we'll conclude the consideration of our list. Madagascar, you have the floor, please.
Merci. Merci.
Thank you, Madam President, Director General, ladies and gentlemen, ministers, distinguished delegates. Allow me to congratulate Madam President and the members of your office for leading the work of the 73rd World Health Assembly. We would like to thank the Director General of WHO for his remarkable work and his leadership in improving health around the world, in Africa and in Madagascar. Elected to the Executive Board for 3 years, Madagascar would like to express its gratitude. Our vision with regard to the health policy is based on the principle monitor and intervene. It applies to any disease which has an epidemic potential, including COVID-19. This monitoring includes improving the capacity to detect, for early detection with an alert system with a rapid response possibility. Intervention is based on prevention and provision of treatment in cases. Therefore, an efficient and responsible partnership which is to the benefit of stakeholders should be developed and implemented. I welcome the technical support that WHO has provided to Madagascar. It is up to us to ensure that we can build capacity of our health staff and to ensure the operational health monitoring. Public health is part of the framework for globalization, which allows development of Madagascar. WHO, therefore, is a key partnership for Madagascar in its efforts to achieve the objective of universal health coverage. Thank you.
Thank you, Honorable Minister. Madam President, contrary to my earlier statement, it appears that we do have a few more countries who've taken the liberty to ask for the floor, if I may. Could we now give the floor to Burundi, to be followed by Guinea? Burundi, you have the floor, please. Okay. Could I now call on Serbia to take the floor, please?
Can we hear each other?
Yes, yes, we can hear you, Honorable Minister. Please proceed. Thank you.
Can we hear each other? Very good. Hello?
We can hear you. Please proceed.
Yeah. Dear Madam President, distinguished delegates, dear colleagues, ladies and gentlemen, we are all facing a difficult time. Cooperation with countries, exchanging knowledge and experience, as well as mutual assistance and support is perhaps most important at this moment. Do not let anyone think there are no cancer, or God forbid there are some enemies, but we all need to fight together against the pandemic caused by the COVID-19 virus. In that sense, we would like to emphasize that the Republic of Serbia has implemented decisive measures in combating and preventing the spread of the virus, representing all the recommendations of the WHO and other international organizations, and respect other states' experiences. At all times, the government of the Republic of Serbia has taken care that all measures are justified and aim at saving the largest possible number of its citizens, lives of its citizens. We would like to express our gratitude to People's Republic of China and the European Union, its member states, and the Russian Federation for their assistance, each in accordance with its capabilities. I'm deeply convinced that in time like this, it is important to leave the victims behind and to focus our energy in fighting the pandemic. The results of the Republic of Serbia in the fight against the virus would never have been so effective if it had not cooperated to exchange the experience with everyone. A joint fight against the pandemic based on the recommendation of the World Health Organization is the only way for us to succeed in defeating the virus. We need to show solidarity and strengthen multilateral cooperation in order to overcome the difficulties we all face together. In this regard, the need to suppress the pandemic actively should take precedence over any political issues and divisions. The answer to the pandemic should be global. No one should be left alone. I do not think only in small countries But on the contrary, even in EU, Italy or Spain, everyone should be taken care of. The Republic of Serbia, as a World Health Organization member state, is highly appreciative of the organization and is active contributor to its work, and firmly believes that any initiatives with the potential to give rise to politicization and divisions within the organization are not to the benefit of an efficient fulfillment of its primary role and mandate. The Republic of Serbia attaches special importance to the work and activities of international organizations in the UN system on the basis of full and consistent adherence to the Charter of the United Nations, norms and principles
Honorable Minister,
of national law, as well as the
Honorable Minister, we will be grateful if you could conclude your statement.
Okay, in this regard, the Republic of Serbia express full support to One China principle as well. Thank you.
Thank you very much, Honorable Minister, for your kind indulgence. We have Guinea-Bissau, and I believe I could yield the floor back to the President after Guinea-Bissau. Guinea-Bissau, you have the floor, please.
Ladies and gentlemen, we have proceeded our present at the 74th session of the World Health Assembly. Faced with the COVID-19 pandemic, Guinea-Bissau not only joined global initiative under WHO directive, but internally adopted several, among them restrictive measures, personal screening, social distance, and the mandatory use of masks. Created in an interministerial committee involving national and international non-governmental organizations and engaged community in the fight against COVID-19. Prepared an emergency plan to combat pandemic. Creation of quick response team is spread through the country. Provision of appropriate place for medical care and specialized medication include hospitalization in tent and hotel for COVID-19 patients. To date, according to the latest statistical data, the country has 990 cases, including 37 recovered, and 4 deaths in universe of 2.510 tests of a population of 7,100 inhabitants. Given the scale of pandemic and the fragility of our health system, WH support was so crucial in the fight against the pandemic. In this context, the country more than ever needs support of WHO to improve the health system as a whole, implement the emergent plan to fight COVID-19 as well as provide urgently masks, rapid tests, lung ventilator, and other medical equipment to reduce the spread and stop the pandemic. To finalize, Republic of Guinea-Bissau and the Republic Popular of China is a one and indivisible. Thank you very much for your kind attention. Thank you.
Thank you very much, Honorable Minister. We do understand that the video for the Order of Malta had a technical problem towards the end. We'll request that we play that intervention again from where the disruption happened, if possible. If not, we'll play the full video once again. crave your indulgence. We'll play the full video of the order for the Malta once again. Thank you very much, Madam President.
The Sovereign Order of Malta is contributing to the global response to the COVID-19 pandemic through its worldwide humanitarian action. It is of greatest importance to reaffirm here the necessity for the broadest possible international cooperation between all stakeholders. We wish to commend the WHO leadership in the fight against coronavirus. The vital role played by faith-based institutions in this emergency is being widely acknowledged. WHO recognizes that religious leaders, faith-based organizations and faith communities can play a major role in saving lives and reducing illness related to COVID-19. It published practical considerations and recommendations specifically for them. The Order of Malta has adapted its medico-social activities and centers accordingly. Its hospitals, clinics and ambulance services are fully active. It helped establish field hospitals and provide PPE, respirators and medication to state institutions and hospitals. Maltese International is intensifying hygiene kit distribution and wash programs, especially for displaced persons in camps. Furthermore, the Order's government recently launched the Doctors to Doctors project with the aim to gather on a virtual platform health experts sharing knowledge and strategies. The project is intended to help countries facing socio-political instability, economic challenges, violence and conflicts to deal with the pandemic. The Order has also scaled up its social services, distributing more food, water and medication to elderly, homeless, isolated, disabled and terminally ill persons. Psychological hotlines and online support platforms have been established to provide comfort to all those distressed by the situation. A number of countries like Germany, Austria, Hungary, Taiwan and Lebanon supported the works of the Order in fighting COVID-19, both in their countries and in third countries, thus witnessing international solidarity and support where it was mostly needed.
COVID.
Thank you, Madam President. That concludes the list of speakers. Thank you.
Thank you. Before we close the discussion on item 3, I wish to address the small number of states that were unable to make their interventions orally for technical reasons. We've discussed it, and I would like to propose that exceptionally, we invite those member states that were unable to connect to the platform to deliver their speech orally. What we are proposing is that they send the written text of their statement to the Secretariat. That text will be posted on the WHO's website and will be subject to the same provisions as the written statement submitted under paragraph 5 of the special procedures, including that they shall form part of the official records of this session. I think that's the best compromise under the circumstances, and I would indulge member states and their cooperation in this regard. And I understand from the Secretariat that we have come to the end of the list of speakers. I now propose that we turn to the draft resolution on COVID-19 response proposed under this agenda item and contained in document A73/CONF/. 1, Rev. 1.
This is just this page, okay?
I'll repeat that reference again. It's document A73 /CONF /1 Rev 1. I would like to draw the attention of the Assembly to the co-sponsors listed on the front of the conference paper. I have been informed that in addition to those member states appearing on the front of the conference paper, the following additional countries have informed the Secretariat that they would like to be recorded as co-sponsors. Those states are Cook Islands, Georgia, Kiribati, Nauru, Papua New Guinea, Philippines, Serbia, Tonga, and Uruguay. Any other countries that would like to co-sponsor the resolution should send an email to the Secretariat today by 1800 Central European Time. I'm going to repeat that. Any other countries that would like to co-sponsor the resolution should send an email to the Secretariat today by 1800 Central European Time at the following address: co-sponsorship@who.int. I'll repeat that address: co-sponsorship@who.int. In this way, your country will be reflected as a co-sponsor in the official records of this meeting. Therefore, you do not need to take the floor to state this. In a moment, I will put the draft resolution to the Assembly for adoption. But before I do, I would like to request that delegates only raise their hand at this point if you wish to object to the adoption of the resolution. So I'm going to repeat that for clarity. I would like to request that delegations only raise their hand at this point if you wish to object to the adoption of the resolution. Please do not raise your hand yet if you wish to make an explanation of position. I repeat, please do not raise your hand at this stage to make an explanation of position. So, let us turn to the draft resolution. Is the Health Assembly prepared to adopt the draft resolution as proposed? I'm just giving the Secretariat a few moments to double check. As I see no requests for the floor, I take it that there is no objection and the resolution is therefore adopted. me to say that?
Yes, because we said we'd give them an opportunity. Sorry, Syria. But this is an explanation of position. Explanation of position. Okay, so now is the time for explanations of position. Yes, read that.
Now is the time for explanations of position. However, before I open the floor to requests for explanations of position, and in the interest of time, I would like to strongly encourage member states wishing to provide an explanation of position to do so in writing by submitting their statement to the Secretariat for publication on the WHO website. So in the interest of time, I would strongly encourage member states wishing to provide an explanation of position to do so in writing by submitting their statement to the Secretariat for publication on the WHO website. May I remind delegations that all written statements, including explanations of position, will be posted in the language of submission on the governing body's webpage of the 73rd World Health Assembly. They will also form part of the official records of the session.
Do we have any flags still up? Okay, so we give the floor to Syria first.
I understand that the delegation of Syria would like to take the floor. Please proceed. So what's happening with Syria?
Syria and Iran, they want to make explanations of position.
So will this be by video?
I don't know. Syria?
Syria, you have the floor, please.
Honorable delegates, we are waiting for the delegation of Syria, who I understand would like to take the floor. We understand that Syria is not quite ready, so we will proceed to the delegation of Iran, who I understand would like to take the floor. I turn the floor to Iran, please.
Madam President, you can hear me?
Yes, please proceed.
Thank you, Madam President. The Islamic Republic of Iran joined consensus on the draft resolution COVID-19 fund as a demonstration of our commitment to work collectively in the fight against the pandemic. We are dismayed by however, that an opportune moment was missed to echo calls of many authoritative figures, including the United Nations Secretary General and the High Commissioner for Human Rights, for lifting of unilateral coercive measures, which are undermining international solidarity and hampering global cooperation against the virus. The unilateral coercive measures in the form of lawful unilateral banking and financial sanctions are not violating basic human rights, in particular the right to health and to life, also posing a serious threat to global public health by hampering international cooperation in health sector. The U.S.
I'm sorry, the Honorable Delegate of Iran. We seem to be having some audio difficulties. Could you just give us a moment to resolve it? Please stay on the line.
Can I continue?
Honorable delegates, while we seek to resolve the audio situation, I propose that we take a 5-minute break, and please don't move far from your mics because we would resume shortly. Thank you.
Thank you.
Thank you, honorable delegates. We're ready to proceed. And this is what we propose with the concurrence of the Honorable Minister from Iran. We will have the Honorable Minister complete his statement. Now, we understand that there may still be some audio difficulties, but if honorable delegates are still having a difficulty hearing the Honorable Minister, we have agreed, given the rules of procedure, that he may submit a written statement of his oral statement that he's now giving, and that statement will still form a part of the official records of the meeting. So, Honorable Minister, if you're still on the line, we now give you the floor.
Thank you, Madam. Can I read out from the beginning?
Yes, please proceed.
Thank you, Madam President. The Islamic Republic of Iran joint consensus on the draft resolution COVID-19 response as a demonstration of our commitment to work collectively in the fight against the pandemic. We are dismayed, however, that an opportune momentum was missed to echo numerous calls by many authoritative figures and bodies, including the United Nations Secretary General and the High Commissioner for Human Rights, for lifting of unilateral coercive measures, which are undermining international solidarity and hampering global cooperation against the viral spread. The unilateral coercive measures in the form of unlawful unilateral banking and financial sanctions are not only violating the basic human rights, in particular the right to health and to life, but also posing a serious threat to global public health by hampering international cooperation in health sector. The US must be held to account for continuing and intensifying their unlawful sanctions against Iran and other nations. Unilateral coercive measures and human solidarity are mutually exclusive. We urge all responsible states and international organizations to stand in the right side of the history by continuing to call for an end to unilateral sanctions as manifestations of crimes against humanity. My delegation requests that this explanation of position be reflected in the report of the proceedings. I thank you, Madam President.
Thank you, Honorable Minister. I now give the floor to the Honorable Delegate from Syria. You now have the floor. We are waiting for a connection from Syria. Please, may we have your indulgence? Honorable delegates, we are still trying to connect with Syria. We are attempting to reconnect.
Yes. Okay. Yes. Thank you very much. Okay.
Hello?
Thank you.
Can you hear me now?
I understand we have the Honorable Delegate of Syria on the line, so you have the floor. Thank you.
Can you hear me now, please?
We can hear you. Please proceed.
Thank you. السيد الرئيس انضمت سوريا للتوافق.
Madam Chair, Syria would like to join the consensus on this draft resolution based on our conviction that it is necessary to guarantee solidarity for the risks that all our countries are currently facing. We welcome the draft resolution and the call to intensify cooperation at all levels in order to be able to contain the COVID-19 pandemic. We also welcome the need for states to have the necessary facilities in terms of diagnostics, treatment and vaccinations in order to be able to promote the response to COVID-19 and the work to eliminate the obstacles. We regret that the resolution is not clearly requesting the removal of coercive unilateral measures that are applied to certain countries, which prevents them from acting effectively, because these have been imposed unilaterally and countries have insisted on keeping these sanctions, which affect the life of citizens in the countries targeted and affect their fundamental rights in this way. The prolongation of this unilateral and coercive extension of these measures during this global health crisis is a violation of the principles that the draft resolution is aimed to work for. And we have seen that the United States and the European Union have not followed the calls of the international community to strengthen capacities of states in order to be able to promote the response to COVID-19. So we would like to say that the best way of applying this resolution would be through an initiative that would invite the removal of all sanctions and measures taken by governments in order to be able to provide the results that we wish for. So we would like to call on the WHO to pay particular attention to the situation of populations living under these situations. Thank you very much, Madam Chair, and my apologies for the delays due to the technical problems. Thank you.
Thank you, sir. I understand that there are no more speakers. So we shall now continue and consider together agenda item 4, invited speakers, and item 9, closure of the assembly. Now I shall invite the Health Assembly to consider the decision contained in document A73/35 to adopt the written silence procedure. That's the decision contained in document A73/35 to adopt the written silence procedure. Is the Assembly ready to adopt this decision?
Yes, it is.
Do I? I understand that
I see no request for floor decisions, therefore.
I see no requests to take the floor. The decision is therefore adopted. Moving right along, let us continue. As provided in Article 14 of the WHO Constitution, the Health Assembly shall select the country in which the next session will be held. May I take that the Health Assembly agrees that the 74th World Health Assembly would be held in Switzerland? I see no objection. It is so decided. Honorable delegates, I shall once again hand over the floor to Madame Michelle. Now, let's see if I can get this right. Boucouz. I am making progress. Boucouz, Director General's Envoy of Multilateral Affairs. Madam, you have the floor. Thank you.
Madam President, Excellencies, yesterday we opened the Assembly, first of its kind in the organization's 73 years history, with words of inspiration and reassurance from global leaders, reaffirming their commitment to global health and to the important work that the World Health Organization